Today we're going to be talking about the Japa syndrome that is affecting the country's workforce, especially the healthcare sector and other sectors, but it's actually affecting Nigeria. Now, as of 2025, Nigeria is facing an unprecedented brain drain, with thousands of professionals leaving the country in search of better opportunity. Now, according to the National Bureau of Statistics, recent reports, between 2020 and 2024, over 1.3 million Nigerian professionals migrated to other countries, with majority going to the United Kingdom, United States of America, Canada, and Australia. Now, the statistics are alarming. In 2024 alone, over 400,000 Nigerian professionals left the country, representing a 25% increase from the previous year. And this trend is not only driving or depriving Nigeria of its brightest mind, but also resulting in an economic loss. Now, a report by the World Bank estimates that Nigeria loses over $10 billion annually due to brain drain. But what is driving this mass exodus? Is it a lack of job opportunities, or the poor working conditioner, or limited career advancement prospects? Or is it a search for a better living standard, security and stability? These are questions we're asking. And before we dive into that, I saw a video this morning by a doctor on Instagram complaining about the state of a medical center, a primary healthcare center in a village. He didn't mention the state, but if I am a doctor working there, the tendency of me leaving is really high, because I will not be able to be productive under such circumstances that has just one forceps and 2 beds with a maternity toilet that is really looks like a public toilet. Those are questions we're asking. Is it the state of the medical centers we have, the brain drain, or the poor remuneration? These are all questions Nigerians are asking, and we want to know more. Now, to help us to understand the complexity of these issues, we are joined today by Dr. Cyriancus Anyawu, Chairman, Board of Trustees, African Nations Diaspora Council. He's also a US-trained medical professional with expertise in hospital management and administration. Thank you so much for joining us.
Thank you very much for welcoming me here.
It's good to have you.
Thank you so much.
So, in your experience, abroad, and I believe you have a certain, from home as well, what would you say is chasing away our medical practitioners, from Nigeria?
Well, I just want to say good morning to viewers and good morning to you. What you have already enumerated is a complete conglomeration of factors that make medical doctors and medical professionals and other persons of other Nigerian citizens to exude to other countries of the world. Reasons are many. Poor working conditions. People who are medical doctors are not duly paid. As you are aware, what's going on in Abuja right now, medical doctors were on the verge of contracting a strike, which is to make sure that patients were going to be suffering setbacks in getting proper medical attention. And the reason was because they have not been paid. And that's poor working condition, because if the doctors and nurses are not duly paid and they're not paid as at when due, it becomes difficult for them to pay, to do the right things in the hospitals where they are engaged to work, which their primary responsibility is to protect life. So now, if the government is not doing what they're supposed to do, working environment is not adequate, and then it's not convenient for medical doctors and medical professionals to proffer their services, it becomes very difficult for them to endure after a certain period of time. But in the foreign countries, these things do not happen. In the United States, for instance, we have over 3 million medical doctors, medical professionals in what organization we call AMPA, Association of Nigerian Physicians in North America. There's so many Nigerian professionals that are in the United States working and doing well. And in fact, it's surprising that when we see political leaders that come to the United States and to other foreign countries seeking medical assistance, or what they call medical tourism, when they get into the clinic, or into the hospital, or into the laboratory, who are they seeing? They're seeing Nigerians. The nurses are Nigerians, the physicians are Nigerians. The reasons why they are there is because of the working environment. We have equipment, we have satisfactory working condition. So Nigerians are there, and they are the ones that are doing it, but they are very highly qualified, very well informed in what they do. So they leave Nigeria, go there looking for greener pasture where the services can be properly rendered and they are happy with the reward that they earn.
All right, let's talk about the salary disparity. How bad is it between Nigeria and doctors working abroad? How bad is the salary difference?
Terribly bad. The working well, of course, you know, there is what we call the financial differences in the forex exchange issues. In the United States, you earn more, and then you are paid on hourly basis.
Can you give a range of how much?
Compared to Nigeria?
Yes.
You could be, I don't think that's proper for me here to say because it varies as well. Because if you're a neurosurgeon, for instance, what you earn is not the same thing with just...
so we just need a range.
On the average.
Yeah.
You could be saying that a medical doctor earns average in a month not less than 4 million naira.
Compared to Nigeria.
Compared to Nigeria, where they are in hundreds. So it's not something that is comparable because also the life style in the United States is higher and is different than what you have here. But Nigerian physicians who are here are very well trained and are very qualified to earn on the average about the same thing. They could be paid the same thing here, and there will be no reason for this mass exodus and brain drain that we are looking at. And that's what the problem is. So people want to make sure that they are comfortable where to work. You just indicated about a clinic or a hospital that
has just one forceps.
Yes, exactly. And that's an embarrassment. So if you go to hospitals, the same thing I was listening to when I got in a few days ago, I was listening to the chairman or president of Nigerian Medical Doctors Association in Abuja here, complaining that in the hospitals, they don't even have equipment. There's something that's applicable to many other states in Nigeria.
Probably worse.
So we do not, if in Abuja, you don't have proper equipment in Abuja to work and to function, imagine what happens in rural areas. So many people are dying. I mean, mortality rate is very high. You know, so we don't expect that Nigerian professionals who are qualified should be underpaid in Nigeria.
Given that they have to make do, you know, with very little just to save lives the way it. But as one who has an expertise in administration, what policy recommendations would you give to see that, you know, for the ones we have here, what policy recommendations would you give to make their lives better or make them look at the condition a bit differently and let passion lead? Well,
policy, again, it varies because you have private hospitals, you have government-owned hospitals, and they'll have, so it depends. The policy guideline may not be unilateral, but you can understand that if the working conditions are commendable and encouraging, definitely the physicians and medical doctors, if you may call them, are going to be staying back in Nigeria to make sure that things go well. I cannot say that is a strict policy guideline other than to make sure that the working conditions are favorable, and it varies. And for instance, hospitals that are privately owned hospitals, the equipment are not there. And as I just want to indicate here, the people that manage hospitals, that is the problem. A medical doctor should not be an administrator of a hospital. They are purely clinical. That's what they're supposed to do. Look into clinical matters, look at health conditions. Diagnostics is different from clinical services that you are providing. In Nigeria, I see a pharmacist making prescriptions. That's not acceptable. Okay? Pharmacists are not supposed to be making prescriptions. You see, chemists, they call themselves doctors, and you see that? That's wrong. Chemist is not a physician. And in hospital management, we have specialized people that attend to hospitals. Their duty is to make sure that everything is omnia parata, everything is ready to go. It is not the doctor that I've gone to hospitals where I see some physicians battling with generators. Power should be there. There should be constant electricity, maybe solar energy, as the case may be today. So you don't expect that a physician and a doctor will be responsible for the cleaning, you'll be responsible for the supply of materials, for surgery in the clinic and in the theater. They are responsible for all that. It shouldn't be. There are people that are specializing in that, making sure that the working condition of physicians are superb, and the doctors just come in to do their work. That's how it happens abroad.
But these are the brain drain things we're talking about. Even in regular work environment, you find one person doing more than 4 roles, and it's something that keeps on happening in Nigeria because you find professionals leaving. But let's come back. Let's still touch on comparison. What are those models you think that could be implemented with the realities on ground in Nigeria today? You've seen the realities on ground. We have brain drain. Doctors are not available. Doctors to patients ratio is alarming, and it's not even what we want to even look at this point in time. So what models do you think could be realistically applicable in Nigeria at this point in time to make sure doctors are delivering quality service, and to also make sure that the working conditions are favorable for them at this point in time? Do you have a quick fix model that could be used immediately? But I don't know, think it's a quick fix, but if wishes were horses.
Yeah, if wishes were horses, beggars would ride. But I think that what needs to be done is that Ministry of Health, the Minister of Health should pay more attention on making sure that the budgetary allocation for hospitals are adequate. And the members of the National Assembly, in approving budget, should ensure that health is priority, because health is wealth, they say. So if we do not have adequate provision of funding for hospitals and for the government to run the hospitals, definitely we will be experiencing brain drain. But I just want to tell you also that the brain drain exposure gives exposure to Nigerian physicians in the international community, because they also gain a lot of experience that comes back. Just like December 2024 that just passed few weeks ago, we had a lot of our physicians that came home on medical mission, came here to assist. We give free surgery for eye, do other clinical, provide other clinical services to patients and to Nigerians free. Now, we're able to do that from the United States, for instance, in particular, because they have exposure, they have gotten what it takes, and they want to give back to Nigeria. So that's what we call brain gain. From brain drain, we have brain gain. And we're trying to make sure that we invite Nigerian professionals in the international community to come back and assist in making sure that Nigerian health sector is much better. And Nigerian professionals also need to collaborate with health managers, healthcare workers, healthcare managers, administrators in hospitals, because that's another area that we need to train people to make sure that there are experts who handle administration and management. It's a complete course in the university. So people have to make sure that people who are interested in that sector will now be trained and be equipped to manage hospitals, so that hospitals can be functionally effective.
All right. That is, I'm just hearing that medical administration is a whole different ballgame altogether. What about the role of private investors? We find private business owners, taking over different sectors of the economy, from the petroleum sector to agriculture. What kind of inputs? Because we have lots. If we can't leave everything on the government, it's obvious their table is full and their hands are full, even if there are budgetary allocations to it. So, what roles do you think private investors could play in managing an administration of hospitals in such a way that it will make, a happy doctor is a happy patient, so would make life easier for the doctors, who will in turn deliver the quality of service every Nigerian deserves?
Yes, there's an opportunity for private investors to come in the health sector. A lot of private investors are also sponsoring hospitals, supply of equipment, supply of materials for hospital management and all of that. But it's a very delicate thing, because where you see businessmen step in, priority, it may convolute, it may really tamper and impinge upon the ethics of medical practice. So we are trying to be careful here, not to make sure that muggles and all the big shots in the financial sector come in and take it. Then their priority is money, profit, margin is what they're looking at, rather than protection of life and protection of life and saving life, which is the primary responsibility of a doctor or a physician in that sector. So if you try to involve big shots who are all about money in the health sector, it might also create a crisis in the process, because their interest is, what are you giving me back? But this is already happening in Nigeria. Last time I did a little bit of interaction with some pharmacists. You see, some pharmacies are owned by private people who have big plaza, big shops, and all of them. They also put pharmacy there. But if you go there, what they are getting is not professional enough. That's why you begin to see pharmacists to make sure that they give the owners of the pharmacy and the shops money back. They have to be charging you. They have to be, prescribing drugs and giving you syringes and injection and things like that, which shouldn't be. That's unethical in the medical profession.
In Nigerians' defense, I would say, when it comes to going and trusting pharmacists and calling them doctor, it says a lot to do about the state of primary health care in Nigeria. And we believe that healthcare, if a primary health care is not affordable enough for an average Nigerian to walk into with adequate facilities, then what are we even talking about healthcare? Have you visited any primary health care in Nigeria since you came in?
Yes, of course. I have visited many.
So what are your thoughts on them and the situation?
They are quacks. They are really underrated. They are very poor standards. Primary health cares that you see in health centers in some states and in some places that is really becoming. They are really an embarrassment in the health sector. Because you just see there, what you see are nurses that we call in the US, we call them nursing assistants. They are not even nurses. They didn't go to proper nursing school, but they are the ones running. They're the ones giving medication. They're the ones giving medical attention to in emergency cases. You see a nurse that is not a gynecologist and is diagnosing a woman that is pregnant and trying to see the woman through. Those are not what should be obtained. We need more physicians. The exodus of Nigerian professionals and doctors to other countries is really creating a lack in our communities and in our environment here and in Nigeria. So the Nigerian government needs to pay attention. I understand there was a time they tried to stop nurses and Nigerian doctors from leaving, and that's not right. They can't stop them when they are not giving them adequate provision for an adequate working environment for them to perform. So they can't allow them to be, they can't stop them from going to seek greener pasture and provide services where the environment is more suitable.
Before we get into long-term solutions and possible solutions, in your experience, I want you to shine your light on the Nigerian healthcare system in general, because you seem to have experience in both, the international scene and what the Nigerian healthcare system looks like. What would you say are those really pressing issues that if it's been addressed at this point in time, we might just see a change?
Well, I think health insurance. Health insurance is a very critical factor. Here, what you do is a kind of cash and carry kind of medical services. We need to have health insurance. If there is health insurance, the patients will receive proper and adequate medical services, not put under pressure for payment. And I have seen also people that are, intensive care unit or emergency centers. When they come in, first of all, you're asking them for money. If they don't have money, they will not be treated, and you see lives lost. We don't think that's proper. But what could solve that is insurance.
But we do have the NHIS.
I understand that we have an NHIS in Nigeria, but there was also crisis there. There was corruption issue in the past where the monies that were being paid people were not being given adequate response.
Yeah, the factor around NHIS is the fact that, number one, most of them, or we have other HMOs, the monies being paid do not cover a certain level of medication, doesn't cover a certain level of surgeries, it doesn't cover, you might go there and they will tell you they don't have the drug to give you, so you have to go out and buy it with your own money. So, how can that be better? What can change? What can we do differently?
The structuring of the HMOs and structuring of health insurance is applicable in other parts of the world, in other climes of the world. It's the same thing. But what happens is you don't have, you have a comprehensive insurance. You have insurance that covers all kinds of sickness and all kinds of, it's really defined. You have to know what your insurance can carry you. Doesn't mean that if you have insurance and then you have terminal ill, everything will be paid. No, that doesn't mean that. Insurance has its own regulatory policy and guidelines, how they function. Okay. So you're having insurance, in most cases, maybe a basic insurance that you have, but it may not cover some other kind of ailment or sickness, so that may befall an individual at the point when they go to the hospital. So you don't expect that when you go to the hospital, because you have insurance, it can cover everything. You have to do your HMO, you have to pay some part of it as well.
So more needs to be done when it comes to health insurance, because Nigerians need access to affordable medical care, and at the same time doctors need a better working environment. Now let's talk about long-term solutions, in your beats as well, and also other doctors abroad who are willing to come home and help, and the government. What ways can we have both private individuals, doctors like you, and the government come together?
I want to correct that. I'm not just a doctor, a physician.
Yes.
I'm a health worker. I'm a medical practitioner in the sense of hospital management administration, but I have general idea of.
I said that.
Yes.
I said that. I mentioned that that was why I asked the questions towards administration.
Okay, very
so
good,
I
very
need
good.
Your experience from hospital administration to being a medical practitioner to being in the public health sector.
Yes.
I want you to give us a broad-term solution, a long-term solution where practitioners like you and other doctors who are, vast in hospital administration and know how hospital administration works, and the government who should be bringing out the funding, and private individuals whom you say you're not comfortable with because they see it as businesses. What way can this group of people collaborate to save the Nigerian health sector and avoid this excessive Japa syndrome that is happening?
Absolutely, a good question. I think I have indicated earlier. It is the responsibility of government to provide adequate working environment for Nigerian physicians, Nigerian doctors, Nigerian health workers, and Nigerian citizens to make sure Nigerian government has the primary responsibility of providing adequate health care services to Nigerian people by having policy framework that enables the environment be suitable for Nigerian doctors to work. Now, having said that, we also need to encourage Nigerian doctors by providing better welfare for them. Accommodation is one, vehicle is another one, and then giving them adequate provision for living standard that would be better than what they will get if they were not doctors. You can't see medical doctor that has finished. You see them, just sweating in the hospitals, cleaning their hands, their face with their hands, battling and shuttling from one place to the other, taking public transport, and all of those things. That's not good in Nigeria. There can be allowances, vehicle allowances given to doctors. There could be accommodation allowances given to doctors. There could be, their own welfare should be put in the front line so that they will have sanity of mind to address healthcare issues.
In terms of administration of hospitals, what could be done to better that?
Oh yeah, that's very important. There should be training of nurses. I've been to hospitals where at the counter, at the reception, I saw doctors or even nurses being rude to patients. That's not done. I saw one, the nurse was saying, "Not me carry you, come here. Not me carry you," like they were in a police station. They were just saying, "Stop, why are you crying?" And instead of pampering and providing adequate care, they are rather hostile to patients. That's not acceptable in a hospital. In a hospital, it's caregiving. You should be patient. There are some ethical practices that must be observed in rendering medical services to people. So we need to train. We are here to provide assistance if needed, to give adequate training and orientation to nurses on how to manage provision of health services and healthcare delivery in hospitals and in clinics around the country. I think the Ministry of Health needs to look into that. It's a very important area that they need to make sure that there's adequate training to doctors and to nurses, particularly on how to attend to patients.
All right. Thank you very much, Dr. Anyawu. It's unfortunately we've run out of time, but there's a lot I'd love us to talk about. But unfortunately, we've run out of time, and we hope that we'll get to have an opportunity to have you once more on the show. So we'll talk a lot more on hospital administration that needs to be looked into, especially in Nigerian hospitals. Once again, thank you so much for joining us on the show this morning.
Thank you so very much for welcoming me.